one point I just got into bed and it just didn't happen. Then the next night, the same sort of thing happened, and then you start this vicious cycle of, I guess, being scared of not sleeping.
It was the height of the pandemic when Hamish Sinclair Ross suddenly found he couldn't sleep, largely because of stress.
After I started struggling to sleep, I'd sort of dread going to bed. It was getting to that 10 o'clock mark, and I'd actually start to feel anxious. It was sort of, you feel it building and it's like worried, oh, am I actually going to sleep tonight? It impacts your mental health, impacts you physically. It really hampers your day-to-day ability to do much.
His GP prescribed sleeping pills, which he was on and off for 18 months while he struggled to find an alternative.
There was nothing that was really accessible and often was really expensive.
It's a major issue that people come to see their doctor with sleep problems. It's one of the most common reasons that they arrive at the doctor, and yet our workforce is not appropriately trained overall.
Sleep researcher Professor Danny Eckert says there's a mistaken belief that sleep is merely a luxury.
There is that message out there that it's somewhat heroic. If you can get by on not very much sleep, then you are somehow stronger or better than other folks around you. That's simply not true. Whenever we ask someone to come to the lab that claims to not sleep very much and still function well, actually if we test them, they're functioning very poorly.
He says there's a disturbing lack of awareness of the damage sleep issues can cause.
You name the condition, if you are sleeping poorly, you're not getting enough sleep, you've got disrupted sleep due to a sleep disorder, it is associated with increased risk of all of those conditions: depression, dementia, heart disease. Untreated severe sleep apnea is associated with losing a decade of your life.
18 months ago, Hamish came across an online program offering cognitive behavioural therapy for insomnia, or CBTI. For Hamish, treatment included limiting caffeine, creating a screen-free bedtime routine, and, perhaps counterintuitively, limiting sleep time to make sure he was tired when he hit the pillow.
I guess it gave me, I just felt power over it. I felt like I was empowered to take control, never looked back. Haven't had a problem since.
Sleep researcher Dr. Alexander Sweetman is the co-creator of the program, called Bedtime Window, which is available to all Australians.
We've found that people participating in our clinical trials of Bedtime Window have reported about a 50% improvement in symptoms of depression, about a 50 to 60% improvement in insomnia symptoms, and also really meaningful improvements in symptoms of anxiety, fatigue, unhelpful beliefs about sleep, and generally how they're feeling and functioning during the day.
More than 1,300 people have taken part in the nationwide trials, receiving free access to the treatment globally recognised as most effective for insomnia. His team runs the program voluntarily.
We've found that although CBTI is the recommended first-line treatment that people with insomnia should receive, only about 1% of Australian adults with insomnia are currently accessing it.
Last year, Flinders University conducted an intensive trial employing the skills of psychologists, dentists, sleep doctors and new monitoring technology to individualise treatment for 30 people with sleep disorders. 90% had their clinical insomnia resolved, while 60% with sleep apnea saw significant improvement. Professor Danny Eckert says investing in treatment programs would save lives and dollars.
This is a huge burden on our healthcare system, but also our productivity, our ability to function optimally, and clearly there are important safety as well as economic consequences.
Following a 2019 federal parliamentary inquiry, the government expressed support for recommendations including making sleep health a national priority, a sleep health awareness campaign and upskilling of health workers. Peak bodies say they're yet to see significant action on any of the recommendations.
So those aspects are absent now at present, and we really need to follow up on that initial support that we've received.
The government told us it's committed to progressing sleep health policy and will update physical activity guidelines to incorporate the latest sleep evidence soon.
Australia has a wonderful history of different health and wellbeing campaigns, so like the anti-smoking cessation campaign, mental health, depression, obesity, physical activity, but we really think that sleep health is the next hill we need to climb, and there's really an urgent need to improve sleep health for the benefit of the whole country.
Inadequate sleep is affecting so many Australians, 4 out of 10 in total, but in terms of clinical conditions, insomnia, sleep apnea, it's at least a couple of million people are walking around with this condition right now, most of whom are undiagnosed and untreated.
It's just shocking how many people go, oh, I've been dealing with this too for years, and it's sad.